malaria still kills a child every minute around the world.
Remains a major public health burden,
causing 600,000 deaths.
600,000. Anytime you have more than 0 people dying of malaria, that's too many, right?
There is evidence that the last effective drug, called artemisinin, is beginning to lose its effectiveness.
Drug-resistant malaria strains in Southeast Asia could threaten the global fight against the disease.
Antimicrobial resistance happens when a parasite that was previously sensitive or susceptible to a drug loses its sensitivity to that drug.
Resistance is not unique to malaria. It's resistance of microorganism towards this external compound that we give to fight it. An organism will try to survive.
Now, independently, there is artemisinin resistance in Africa.
We are seeing a delayed parasite clearance. The medicine is taking longer to cure the patient.
I developed malaria during the pregnancy. I was scared for myself, my life, and also for the life of my baby.
There is no replacement for artemisinin-based drugs.
You will see an increase in the number of cases, especially in the children, and with that an increase in the number of severe malaria cases and malaria-attributable deaths.
There's a look that you get when somebody is getting ready to die. And when the patient is 4 or 5 years old, there's a look that you get that you're the last person they look at. And they look right through you into your soul. And you can't save him.
It's really important to stay one step ahead. We have to constantly keep on top of what the parasite is doing and develop new ways to approach dealing with them. Our job at MMV is to give countries the tools they need so that they can decide based on their own local circumstances which is best for them. There are a number of interventions that we can use. We are involved in supporting pilot projects, implementing what's called multiple first-line treatments. And that's when you have 2 or more first-line drugs being used in a country, which makes it harder for the parasite to evolve resistance.
MFT allows you to switch up on the parasite, and so it has to relearn.
Right now we're working on a project with a number of partners, supported by the GHIT Fund, to develop the first co-formulated and child-friendly version of a triple ACT to protect the existing product and to make it more effective against resistant parasites.
MMV and Novartis are working together to develop next-generation antimalarial drugs. The ganaplacide-lumefantrine combination provides a new class of treatments that patients could be provided. Beyond this, we are challenging ourselves together to see whether we could arrive at a single-dose cure, and the work is in progress.
We discover and develop new medicine in face of all the challenges. We'll continue to do it until the fight is over.
600,000 people dying a year is real. Let's get malaria deaths to 0.